baby.
We in here, yeah, we in here, 'cause we been.
Y'all better get comfortable with saying black.
We in here, yeah, we in here,
Black versus the Board of Education.
'cause we came here, rid of us now. We in here, yeah, we in here, 'cause we came here, rid of us now. And you know that we will, and we're going to do what you been here.
That's why we are indeed a whole mood.
That's it.
Happy Monday, and welcome to another episode of Black versus the Board of Education. My name is Miss Laureen, and we are so excited to have you here and joining us for our last installment of our Civic Engagement series. This episode is called The Primary Blitz. And we have a fantastic candidate joining us today. And it says that I'm having some trouble streaming on Facebook. So can you make sure that that's just something on my end and that we're taking care of that? I would really appreciate it. But before we invite our candidate to the stage, I just want to check in with you guys really quickly. How was your weekend? Like what happened, Miss Quinessa? Tell me something good. I need some good news.
My weekend was good. We went to the Martin Luther King Unity event at Chico State.
Okay.
And we did some tabling there, hung out with the community. They had a presentation, which was great. Beautiful keynote speaker.
Oh, nice.
All around great time.
Now you went with Miss Keela and you had Miss Lania and Miss Layla with you. So tell me something. How different was Chico from Sacramento, or do you think y'all took the atmosphere with you? Y'all just did you?
I think there was a lot more homelessness
Okay.
in Chico that we noticed. Like right when we were like going up to the campus, there was a lot of people like crop tops, but like all this other
You
stuff.
said crop tops.
Yeah, like crop tops.
Wait. How we get crop tops and homelessness in the same sentence? I'm confused.
It was like a crop top by like default, like rip.
Oh, it was. Oh,
Yeah.
Child, you know what? I can't
wasn't
do
done.
nothing with Keela today.
I'm sorry. I'm on one.
So tell me about this crop top, okay?
Okay, so like yeah, it was like a crop top by default. Like it was all ripped, and then like it just like half, and like the back was out, but like it was longer than the front. So it was just a lot going on.
Okay.
But no, I definitely think we brought Sac to Chico. There was a rapper that was there, and he said he was from Sacramento, and everybody was hyped.
Oh,
Yeah, so he was like,
what was the rapper? What was his name?
I don't remember.
Oh,
He had a red beanie on, and his daughter.
He had a red beanie.
He had a red beanie on, and
Okay.
his daughter was fire. She started rapping. I got mad and recorded it, but
Oh,
she was a
It was
vibe.
really good.
She was really good.
okay. Adrian, you and I had a chance to hang out with the fellas and Miss Lisa over at Burbank. So tell me, what were some of the things that stood out about you? We went to the what was it?
Youth and Economic Justice Summit.
Okay. Yep.
Yeah.
That sounds about right.
I think so.
I thought it was the Youth Social and Economic Justice Summit, but
I'm not gonna quit.
wherever it was at Burbank, that's what we were at yesterday. Okay. And what were you feeling about the event? How were you feeling?
I liked it. It was a lot of youth there.
Mm-hmm.
They were very vocal about their issues, and they jumped at the chance to speak. So it was very fun talking to them and learning their experiences.
And you guys know, like with our little game board that we always have like a lot of people around.
Oh, yeah.
And I felt like people were just kind of standing like, can y'all move out the way? Because we want to play too. So did you guys have that same experience out in Chico?
Yes.
Yeah.
So like we were in the like main quad area at first because we were trying to like there's like 3 different areas to go. So we were trying to like experience all of it. So then we went back upstairs, and then Miss Jackson was like, you can take over whenever you feel like it.
She was getting kind of overwhelmed
Yeah,
that
and-
she had such a big
Oh,
crowd
wow.
at
Yeah.
the table.
And it was all like 10 under. Like
It was
popping.
babies.
Yeah.
The babies were trying.
the babies
They
was
was coming back. They was like, let
Okay.
me answer this question. Like it was a long.
I love it.
Yeah.
I love it. Well, I always talk about intentional community building, and part of that is just showing up where we can be in space with people and kind of tell them about us and how we like to bring the atmosphere and change the atmosphere when we show up in the building. And I heard that y'all did that this weekend, so kudos to y'all. Without further ado, we are going to bring. You know what? We sitting up here talking, and didn't nobody bring Miss Anaya up here. My bad, Anaya. I don't know why you were backstage the whole time, but go ahead and tell us about your weekend. What'd you do?
Yeah. Well, this week
I did community service with the NAACP here, but I want to share last weekend I went to go see Drake and J. Cole in concert. And that was amazing.
not you saw Jake. Okay, J. Cole
Sorry,
and Drake.
I got excited.
Okay.
Yes.
Was it everything that you hoped it would be and more?
Yes, and I'm sad because I want to go back and I can't.
You looked cute.
So,
Ooh,
thank
she
you.
looked cute.
Thank you.
I liked it. I said, "Ooh,
You must have posted something on social media because I need to go back and see what you had on, see if it was appropriate.
Oh,
it
for
was.
sure.
I
My
would've
mom
said
was there with me. She picked my outfit out. She was like,
Wait,
"Hey,
your
this
mama
looks
went
good."
too?
She didn't go to the concert, but
Oh.
me and my friend went. We stayed at a hotel, 21 plus to check in. So she was like, "I'll come." So yeah.
Okay. I'm gonna have to text your mom after the show and see what the heck is going on. But without further ado, we're gonna bring up our special guest of the episode. Dr. Richard Pan is joining us, and I'm so excited that he's here. Can you take a couple of minutes to just introduce yourself to people who may not be familiar with you, and we will get the conversation started.
Sure. Well, it's great to be here with all of you. I'm Dr. Richard Pan. I'm a pediatrician. I actually practice at the Sacramento County Health Center, and I'm running for mayor of Sacramento. I actually, was at UC Davis for about 12 years, where I got pediatricians out into the community, served on the First Five Commission, organized our Children's Health Initiative. I actually founded and chaired a Children's Health Initiative to get 65,000 children in our area healthcare coverage who didn't have healthcare coverage before, and then when the Great Recession hit, ran for the state legislature. And so I actually served for 2 terms in the assembly, and then 8 years in the state Senate, where I led a lot of health initiatives, including being sure we got all our undocumented Californians healthcare coverage, banned discrimination for pre-existing conditions, implemented the Affordable Care Act, be sure we got people protected with public health, and then thought I was pretty much done when I termed out in 2022, and going back to practice, and decided, and looked around what was going on in the community and decided to run for mayor of Sacramento because the challenges we see facing our community with homelessness and public safety and other issues, and in fact, many affecting our youth. I actually currently serve on the board. I've been on the board for United Way, where we've been focusing on trying to end generational poverty. And I'm also now on the board of Improve Your Tomorrow, which actually helps youth of color to succeed in school, to graduate high school. And also we're working on trying to improve graduation rates in college as well. So it's great to be here with all of you.
Fantastic. And you're welcome here at any time. Regardless of how the election turns out, we want you to know that you're welcome here. Additionally, what I would like to say to the people who may be watching right now, we know that ballots have already gone out. And so if you're still on the fence and you have something that you want to add to the conversation, like a comment or a question for Dr. Pan, please feel free to do so in the chat. If you're also just undecided and maybe something in this conversation may help you decide who's the best candidate for you. Without belaboring the point, I'm going to start with Miss Anaya since we missed her in the opening. With your first question, Miss Lady.
Okay, hello. So my first question is, I read about you a little bit, and it said that you were born and raised on the East Coast. I just wanted to know what prompted you to move to the West Coast.
Oh, well, actually, I'm a child of immigrants. My parents actually immigrated from Taiwan for graduate studies here in the United States and stayed. So I was born in the East Coast because my parents, actually, my father was first in academia, and then he worked for the federal government. And so we moved around quite a bit. And then I did my both college and medical training in the East Coast. Went to Johns Hopkins for college, and then University of Pittsburgh for medical school. Did my residency and fellowship in Boston. So, and actually my focus during my medical training was on social determinants of health, community health. And in fact, when I finished my training, UC Davis was looking to recruit someone to teach our pediatric residents at UC Davis about community health and to start a child advocacy training program. So I jumped at the opportunity to be able to do that. And that's how I ended up moving to Sacramento. And coming to Sacramento, met my wife and raised my kids. So definitely settled down in Sacramento.
Awesome. Adrian.
So on your website, you mentioned that Sacramento as a whole has missed out on economic growth and other opportunities due to the city council sending mixed or unrealistic messages. Can you kind of give an example of where you've seen that?
Yeah, well, fortunately, we do have a bit of a crisis of leadership in Sacramento. Actually, one unfortunate example is actually on the ballot right now with the mayor election. That's Measure C. So Measure C is that it's actually a tax increase that would more than double the business operations tax, as they call it, on licensed healthcare, licensed professionals, not just healthcare professionals, by the way. It's all licensed professionals who are having small businesses. And where's the crisis of leadership there? Well, the challenge is that when they discussed this particular measure and decided to put it on the ballot, they didn't engage the people who would be affected. Most of the organizations that represented these licensed professionals and their businesses were never notified or contacted. The Sacramento Bee reported that they actually violated the city charter and not putting the notice as required by the city charter. And so that's not really how you want to do things. If you're going to do something in the city as city government, you should be engaging the people who are going to be affected, right? If you're going to do something in a neighborhood, you should be notifying that neighborhood and having discussions with that neighborhood about what's the best way to go about doing that. So this is what we need to change in city government here in Sacramento. We need a city government that's much more responsive to the people, that engages the people who are being affected by the very policies that we're adopting, not saying, well, too bad it's on the ballot. And in fact, there's not even an opposition statement to the on the measure because, again, no one knew about it until it showed up on the ballot, literally. And in fact, the notification that was put out was actually put out after essentially the ballots were mailed to people.
Wow. Miss Keela.
So homelessness is a big issue in Sacramento and has been for a while. So can you explain how you would address it and how long it would take for the problem to resolve?
Well, this is a ongoing, long-standing problem, so we're probably not going to fix it very quickly. But there are essentially three main elements I want to address in terms of addressing homelessness. So first of all, we need to understand that we have too many people who are at risk of becoming homeless or who've recently become homeless, usually because of a financial challenge, right? Car broke down, healthcare expense, something, and now they're a few $100s short of be able to make rent. And so we need to find ways to be able to help those folks stay in their homes, or if they've recently become homeless, get them rehoused as soon as possible. And in fact, when I was in the legislature, actually passed a set of reforms called CalAIM, which includes addressing some of these what I call social terms of health. And you can actually draw down federal money in order to help people, provide people rental assistance and housing navigation. So we can try to help people who are on Medi-Cal, who are basically the lower income folks, to be able to help them try to stay in their own homes. And in fact, actually, I serve on the United Way board, and we're already starting to do that, right? We're through this program. So this is a new program, and it's an opportunity, again, to draw down additional funds for that, because right now we have a city and a state that unfortunately is in the budget deficit. The other challenge we have is we have 5,000 chronically homeless people on the streets right now. And many of them, because they've been on the street for a while, often have significant mental health or substance use problems. Not all of them, but many of them do. And so we need to find a place for them to go where they can get help and support, and so they can be successful. And so, we need to definitely work on trying to find more locations, safe down sites, and then, of course, permanent housing. And then finally, we have a housing shortage. There's a housing shortage in the whole state, but it's including here in Sacramento. And we need to maximize and increase the amount of housing we build. Across the spectrum, and particularly affordable housing, because we don't have enough places for people to go. And so things the city can do is try to, streamline permitting. We shouldn't delay housing. We should try to figure out what we can do to reduce the cost of housing. Part of the reason housing is expensive is sometimes some of it's the fees that we add on, as well as the fact that we have a shortage. So all of these things will help decrease the cost and also increase the supply of housing, which is what people desperately want to see. And so, we want to keep people in their homes. We want to get people off the streets who are chronically homeless with help that they need to succeed. And then we need to increase the amount of housing so we can bring down the cost of housing.
Hi, I just want to ask a little bit of a more general question. Why did you make that transition from the medical field to politics?
That's a great question. I like to say my journey in my career went from the micro to the macro. What I mean by that is, in college, I was a biophysics major. My goal was going to medicine, discover what I call the next great cure, right? Studied DNA and molecular biology and so forth. But as I went through my medical training, I realized that my passion was really more about what can we do to be sure that when people discover the next great cures, we still need people to do that people have access to those. And also, how do we build healthier communities? Because we know that most of people's health is driven by, the community they live in, right? The social and physical environment in which they live. Are they in a supportive environment, or one where they're constantly, afraid of being attacked, of crime, of not having enough resources, that they're going to lose their home, things like that, right? And so those are what we call the social terms of health. And actually, I ended up coming to Sacramento to teach doctors about what we can try to do as community builders to help strengthen communities and make communities safe and healthy. And that's frankly what I devoted my career to as well. And so, of course, the ultimate expression of that is getting engaged in public policy. And I never thought that I'd be running for office because I was a child of immigrants. I did not see people look like me in elected office when I was growing up. Okay, there were very few people of color that I ever saw in elected office. In fact, let me just say that when President Obama got elected president, that was, obviously it was very important for the Black community to see a Black man being president, but it was also important to many of us who aren't Black, who are of the other colors. That this Asian man was like, wow, we can have someone who's a person of color be president of the United States. So, and frankly, when the Great Recession hit, I finally said, well, if I'm not willing to throw my hat in the ring and run, even though almost my entire life was like, well, no one would ever vote for someone like me because I'm Asian. And so I decided to run, and I actually won that election in 2010. So, and then as a legislator, of course, continued to work on those social determinants. But yeah, that's how I made the transition sort of from medicine to public policy and being an elected official. But I should point out that, by the way, throughout my entire time in the legislature, and even now, I still continue to practice because it's so important to me that I stay in touch with people and I continue to take care of families so I know what kind of struggles they're facing.
Awesome. Quick question, because there are quite a few of you running for mayor. So what actually sets you apart from your competition or from the others that are currently running with you or against you?
Well, I appreciate that question. I think what sets me apart is the fact that I've gotten results for the people of Sacramento and the people of California. So when I first came to the state legislature, we had a $28 billion deficit. There were articles across the country, even in international magazines, saying California is ungovernable. We could, that this was an intractable problem. And by the time I left the legislature, we had a $30 billion reserve to help buffer the state against future downturns, right? So in the same way that our city is actually facing now a $66 million deficit, I'm going to go to work to be sure that we bring fiscal stability and back to our city. Now, as a doctor, I focused a lot on being sure people got healthcare coverage. And in fact, when I first came to the legislature, we had the uninsured rate was about 17%. And that wasn't just because of the Great Recession. I mean, it had been at that level for decades. And people said, well, it's just really hard to bring down and it's almost impossible. Well, by the time I left the legislature, we got it down to 7%. So we cut it by more than half. And that's through a whole, I can start rattling off all the policy things we did, but basically that's by working the problem. And that's what I do. I work the problem. I look at the results. I have a background in public health. We take a public health approach. We look at the facts, and then we work the problem. And that's what I did, and that's how I delivered those results. I've done many other things as well. Be sure we got kids, fed during the summer through our Million Meal program. Be sure we got, we did a lot of things to try to be sure we can help support our families and our youth. But it is about delivering results. And that's what I think people are frustrated with is that there's a lot of talk about homelessness. There's a lot of talk about the issues around safety and blight, but they don't see action. And that's what I'm going to be focused on, is making tangible results that people can see.
And just a second part to my question, because I understand that there is a deficit in the city as well as the state. And there are proponents who would say, or opponents who would say, that the reason that we have such a deficit is because we are trying to prioritize healthcare for undocumented immigrants. So how would you respond to that, to the folks who use that as like kind of like their line to say we don't need anybody else like this running government? How would you respond to that? And then after me, the next voice you will hear is Anaya.
Sure. You know, just because we don't provide someone healthcare coverage doesn't mean they don't have healthcare needs and that they don't eventually seek healthcare. Oftentimes later and sicker, right?
Mm-hmm.
So actually, before we actually implemented the Affordable Care Act, and this was before I was in the legislature, under Governor Schwarzenegger, they were trying to work on some health reform. And one of the things people noted is that for every person who's insured, about $1,000 per year of their premiums was going to provide care to people who didn't have insurance. That included a lot of people who are undocumented, right? Because if they didn't have insurance, as I said, again, people who don't have insurance, they don't tend to go to see the doctor as much and so forth, but then they get even sicker. And then when they show up, they're a lot sicker, right? In the ER and so forth. And we still, take care of them, and we need to take care of them. And so frankly, and by the way, they also pay taxes. They're working into paying taxes, sales tax, income tax, all that. So doesn't make sense for our state to say, well, you know what, we're not going to provide them health care, and because we quote unquote can't afford it, when basically we're still going to bear the cost of providing care in a way that is less effective for them and is more costly for us.
Miss Anaya?
Okay, my question is, are there any initiatives that you want to put in motion that you feel like would be more successful or get done faster if you were to become mayor?
Yeah, well, I think that, first of all, I'm going to have a particular focus right now on homelessness, right? And being sure we restore order to our public spaces. I appreciate that. Actually, one of the forums I was at recently, in fact, over at the Black Expo last weekend, one of the youth actually talked about the challenges they had going about their neighborhood because you had people camping on sidewalks, and there was, all sorts of mess around, needles, other types of things as well. And that was very frustrating because they felt unsafe. They ended up, they couldn't use the sidewalk. They ended up walking the streets, which can be dangerous, with cars driving by, et cetera. And so, people want to see that we have order in our public spaces, that streets and parks are available. At the same time, we need to provide help for the people who are getting off the streets, right? And so really going to be focused very much on addressing the homeless issue. One of the other things is we need the city to be much more responsive. So we have a 311 system, right? If you have you see a problem in the city, you contact 311, assuming it's not an emergency, when in which case you call 911. And in fact, the city reported they get 120 complaints a day on 311 related to homelessness. They also reported it takes them 16 days before they respond to that. That's over 2 weeks.
Days.
We can do better than that, right? So I want to be sure our city is more responsive as well. So certainly I've got to work with the fellow city council members and the manager, but we've got to have a much more responsive city and to address the problems that people bring up to us.
So where do you feel that Sacramento is failing or facing challenges where you see other cities are excelling in?
Well, first of all, I would say is that Sacramento is an amazing place. I mean, I love the city. That's why I'm running. But you're right. I think we have a crisis in leadership, and we need to have a mayor who people can believe in, that has integrity, that's willing to accept responsibility for what's going on in the city. We are a little challenged because the mayor is not the CEO of the city, but that's okay. I'm fine with that. And I will work with the council and the city manager. But I think that's what's important is that, the mayor needs to accept responsibility for the decisions that the city council makes. So the city council and the mayor need to take responsibility for that. And so when the city staff do what we ask them to do, we need to have their back, right? And if it turns out what we ask them to do isn't quite the right thing, then we need to go back and say, okay, we need to readjust, but not blame them when things don't turn out well. You also see this back and forth between the city and the county. We have to be partners in this because after all, the county's who gets the money for the mental health and the substance use and other social services. We have to be partners, and it's not helpful if the city and the county blame each other for problems. We need to work together, and part of that is not throwing blame at other people, unless you really have to. But it's not. But frankly, it's not. It doesn't help anyone when we throw blame, right? So it's going to be important that people work together, stop throwing blame, and say, we're on the same team. We're trying to get to the same goal. We may have some differences of opinion. That's fine, but let's work those out, and let's be sure we make progress for the people.
Miss Keela.
So me, Miss Lorene, and Anaya went to a city council meeting back in December.
Child, I don't even remember.
Yeah, I think it was about 2 months ago.
Okay.
But I just wanted to express how the city council members were taking, it just seemed the tone in the room and just the energy in the room just felt so just not good. It wasn't good energy. We felt that the city council members were just being rude, very dismissive off of people. And you just mentioned partnership, but it didn't feel anything like that. It just felt like we were almost getting attacked. And it just our opinions didn't matter, or it's just the little 2-minute rule they have. It just felt very brushed off and very dismissive. Even the city council members were talking while other students were talking. And that's, to me, that takes courage for a 14-year-old to even say anything.
Yeah.
So it's just the fact that everyone seemed very dismissive. It just seems like a more ongoing issue.
Do you have a question for him regarding the dismissiveness that you saw?
Just kind of why would that be? Or just kind of why do you think they're like that in that situation, I guess?
Okay. Dr. Pan?
Yeah, you know what? You're not the first person I've heard this from. And, I know many city council members, they're good people, but there's the tone inside the chamber, right? And unfortunately, also reflective outside the chamber too, right? Is not one that seems to be welcoming of people and their ideas. And, and frankly, I've heard from other people that sometimes it get pretty chaotic inside there too, right? Inside. So I don't know about your experience at that particular meeting. And there are people who are trying to be disruptive in there. So, that it can be a little challenging inside there as well. But, and this sort of again loops, I'm not, Measure C and some other stuff too, right? Where it just seems like the leadership in the city is not really listening, right? And that they're, as you said, dismissive. So when people brought up the concern about Measure C, all the count, it seems like they sort of said, well, yeah, we violated the charter, but then but that requirement isn't necessary or something well, that's not the right way to look at it, right?
Right.
You read the Sacramento Bee article about the response from the city council about the potential charter violation. They said, well, the lawyer said it might not be a problem, right? But they're missing the fundamental point. It's we can be legalistic about something, but what's more important is, did you engage people, right? Were you listening? And so when you went to the city council and said they were dismissive and they were talking while you're presenting, and you're right, it's not easy to go up to that up to that podium and testify. I mean, they're all sitting up there, they kind of staring, looking down at you there. So it can be pretty intimidating, to do that. And really want to thank the courage of the youth who did testify. But yeah, I mean, we need to change the tone in the chamber and outside the chamber when it comes to the city council, I think, in that regards.
And I just want to add just really quickly, because actually you just said that you were on the IYT board, and those boys who were up testifying were from IYT.
Yeah.
And I thought that was very interesting. Additionally, I just want to say that I had the opportunity to be in the room right after the Stephon Clark situation, incident, murder, however people, term it. And what I saw was there were a lot of upset people. And a lot of times when you engage elected officials and you're trying to express something to them and they turn a deaf ear, or they think they know better than you, or they're not there for the right reasons, sometimes you do piss people off and they do act out. And so as a mayor, when you hear something uncomfortable, or you have a specific demographic of people or some type of people who come into there and they say really harsh things, are you going to be the type of mayor that just shuts down public comment and clears the room, or are you going to sit and listen and take it?
Well, I think it's important that, first of all, we listen to people. We do have to have, rules of behavior in a public chamber, right? Because we have to be sure we keep everyone safe, including the other people in the audience. But we also need to be fair to everyone. In fact, I've chaired committees in the California legislature. I was chair of the health committee and several other committees as well. And sometimes we had to debate some very contentious issues, right? And people were very passionate, and some people perhaps beyond passionate about their issues and got very aggressive. And what's important though is that is to listen and also treat everyone fairly, right? And to be sure that everyone has a chance to say their piece, right? And that we give people the opportunity to provide their testimony and any supporting information that they want to provide to the committee, or in this case, the city council. So I think it is important to review what the rules are. It's important that we set appropriate expectations for people about what what's appropriate in the chamber, so that people understand. And certainly, I think we want to welcome anyone who has something constructive to say to be able to present at the city council, right? Or any other frankly, elected body, right? We want people to be able to that's their right to petition the government.
Right.
I guess to add on also, like, what would you recommend to do in that situation? Like, say if, people do feel shut down, like, what would you recommend for them to do at that point?
Well, again, I think what's important is that we have clearly set out expectations and guidelines for people, and that there's general agreement that those are fair, right? And so that everyone knows coming in, what they can do, and so that when people want to be constructive, they have an opportunity to then engage the city council. I think as the chair of the council, right? That's what the mayor's role is, the chair of the council. As the chair, needs to be sure we set the appropriate tone. That's what I did when I chaired committee hearings. We ensured that the different sides were heard, that everyone had a chance to say their piece. We did have to set time limits and so forth because frankly, you want to be sure everyone has a chance to be heard, right? So you can't have someone taking up all the time. But I think when you are very clear about and you're very consistent, being very consistent and clear about the rules and expectations, and also being sure everyone has an opportunity to be able to communicate what they want to communicate. And so some of it's testimony, the verbal part, some of it is things that they could submit too as well, and communicate. So for example, someone may have something more and they can say in the time period, but they would have the opportunity then to provide it in writing or some other mode. So those are the types of things, so that everyone has a chance to be heard and have a chance to express their thoughts to the city council.
Ms. Quinessa.
A big part of your platform from the research that I did was creating safe neighborhoods. Can you talk about the specifics of the plan you have for that?
Yeah, well, it's important that that people feel safe in their community, right? And so that involves several different things. One is that we want to be sure that our public spaces are clean and orderly, right? Our parks, our streets, areas around our schools are clean and orderly, so that people can go to the park and feel safe, that they can go from walk along the sidewalks. In fact, if we want to get more people to walk and not use cars, but for those who have cars, right, people need to be able to feel safe, walking along the sidewalks, right? We also want to be sure that we're engaging people, the neighborhood, right? Because a neighborhood is only as safe as the people who live in there feel it's safe, right? So we need to engage the people who live in the community as partners in assuring the safety of that community. one of the things I did when I was in the legislature, I actually worked with the Mac Road Partnership because there had a couple of violent incidents, and they said, okay, well, what can we do to address that? Well, frankly, part of it is that many of the youth didn't have a place to go, right? And so, we actually invested in creating, basketball court, some community center, other types of events, and so forth for youth to be able to engage in a positive way and also connect. One of the things that we know when it comes to public safety is that neighborhoods that are more connected with each other, where people are more connected, are safer ones. Ones where people are more isolated and they have the opportunities to get to know their neighbors and other people in the community tend to be less safe, right? So we want to try to build those social networks in the communities. Actually, when I was in the first 5 commission, we knew that was actually better for health as well. You get better health outcomes, you get better safety outcomes. So how do we facilitate building connections between people who live in the community, so you can be supportive of each other as well. And then we also need to, I think, frankly, invest in community policing as well. So safety isn't all about law enforcement, but there's certainly part of it. And so if all law enforcement does is show up and arrest people, well, that's not building a relationship, right? So we want to be sure that we have a better connection between any law enforcement officers and the communities that they're patrolling as well, and so that the police are partners with the community and not simply someone who shows up when there's a crime. So again, it's about building those, facilitating building those networks, social networks in communities that are going to help us make them safer, and looking for opportunities to do that as a city, and also working frankly with neighborhood associations, not-for-profits, in doing that.
Now, we know that all politics are local, and I hear you referring to your experience in the legislature. And as a former legislative staffer of 16 years, there are certain things that I've seen at the local city council meetings that I never saw in the state capitol. And so I'm just, and shout out to Terrell Olive over at Mac Road Partnership. That is a huge initiative in this community that aims to help children. But I'm just wondering, you may be setting yourself up to experience some things that were never really that evident at the Capitol. So I'm just wondering, like, I heard you talk about people having the right to speak, but I also heard you talk about decorum and basically respectability politics. So my question for you is, are you ready for the reality of what it looks like when people are pissed off and they haven't been heard for, I don't remember how long Daryl's been here as the mayor, but are you ready to deal with the fallout because people haven't been listened to for, and I didn't mean to call him by his first name, Mr. Steinberg, Mayor Steinberg. I'm just wondering, are you ready to deal with the fallout of people who have felt maligned for these last, 8 years or so? I don't know how long he's been there. And people who have been let down continuously, but they still, normally people don't show up until they're mad about something. And so are you ready to deal with the fallout of folks that you actually have to live around? Because we know at the Capitol, you could have folks coming in from any part of California, but people who are now going to be able to show up basically to your doorstep, are you ready for the fallout that may come, especially when we got a bunch of mean girls occupying space on your city council?
Well, let's put it this way. I believe I am. I'm sure it's going to be challenging. I've had to deal with some fairly challenging crowds in the Capitol. For example, around my vaccination bills and some of the other legislation. So
now, were you the chair when somebody threw their menstrual blood in the chamber?
I was the target of the menstrual blood. Yes.
Okay, you were the target. Got it. You see how the kids are looking at me like, wait, what? Yeah, they shut down the chamber. But go ahead. I'm sorry. I didn't mean to cut you off.
Someone threw menstrual blood from the public gallery onto the Senate floor. First time anyone's intentionally thrown something, from I understand, from the public gallery onto the Senate floor while legislators were sitting in session. I've also been attacked on the street. I was, assaulted on the street. Walking to a restaurant in Sacramento by, again, another anti-vaccine extremist. So, I've had to deal with some challenging situations myself. I agree with you. City, city, and I call politics. I mean, the city is much closer to people's daily lives than the state is, right? And there's going to be people who are very upset with, what they see as failures of the city. And frankly, part of the reason I'm running is because I see there are failures in the city. So yes, I'm going to have to deal with that blowback, right? I'm going to have to figure out, how do I rebuild confidence, people's confidence in the city? What are the things we're going to need to do so that people realize that, you know what, there is a new day in City Hall, and that we are going to be listening to people. Can I promise everyone that we're going to make everyone happy? No, but I think what we can do is we can listen to people, and we can work with people, and hopefully together, with a little give and take, we can we will move ahead in addressing solutions to the problems that people see in their communities and in their own neighborhoods, right? That's why they get mad when they see that things aren't happening. And that's what I'm going to focus on. But frankly, I'm running on a back to basics form, right? I think, the city needs to get focused on the essential things the city needs to do. We need to be more responsive to people. We need to, build up our neighborhoods. So it's not, the state has their own bigger, other issues they deal with, but the city needs to be focused on, particularly on local issues, and restore the confidence people have in city government.
Miss Anaya.
Okay, so just wondering if you have any type of relationship with any of your opponents. And then my second question is, if you do end up winning the election, do you plan to kind of stay in contact with them and anything that they want to implement? Do you think you'll work kind of with them to do that as well?
Yeah, well, actually, we all know each other for different roles, so I appreciate that. For example, Dr. Kofer, we're both public health experts who grew up in Pittsburgh, Pennsylvania, right?
Oh,
yeah. So we actually chat a little bit about the different parts of town in Pittsburgh that we grew up in. And of course, I've seen her work in public health in the state capitol, because she works for an advocacy organization in public health. I'm a public health leader, right? And I chaired the health committee. So there are a lot of things we had done, before. Again, Steve Hansen, when he was on city council, I worked with him when I was, the state legislator, right? Including the fact he represented downtown. In fact, to be frank, he actually was one of the people who talked about to encourage me to run in the first place. And then Kevin McCarty, I guess I'm allowed to say this because he's already said it. I actually used to be his kid's pediatrician. So, and of course,
y'all are all interconnected. Okay.
And of course, I worked with him as, because we're part of the same delegation, Sacramento delegation. I guess it's not HIPAA violation since he already said that in public forums, but so we've all worked together in different ways to help improve the city of Sacramento, and that's why I certainly hope that people wanted us to do in our previous roles. I'm sure each one of us, otherwise we wouldn't be running, thinks we're going to be the best mayor of Sacramento. I certainly think I would be the best one of us to be mayor. Otherwise, I'd be supporting one of the other ones. But also, I look forward to working with them. I mean, each person has their own assets and things that they bring to the table, and so we're going to be running an election. But after the voters decide, not us, the voters, you will decide which one of us will serve as mayor. Then I think we come back together because we all love this city, and we want to see the city succeed. And so, I certainly, if I'm elected mayor, will be reaching out to each one of them, and I hope that. One of the others,
the phone.
I'll be working with them as well, and I'll continue to be a community leader. I've served on the United Way board, some other things. So those are the things that we all need to come together again after the election and do what's best for the city.
Adrian.
If elected, are there any policies that Mayor Steinberg put in place that you'd want to reverse, or any promises he has said that you want to finish?
Well, I think that first of all, Mayor Steinberg and I have worked together. He's my predecessor in the state Senate, and he's done a lot of work in the mental health sphere and so forth. Um, one of the things that I want to do though is that I think first of all actually reset the tone in the city council chamber, both inside and out. Right? It's said what you described, the frustration I hear from other people. What we saw with Measure C and some other things that the city council did where they didn't give proper notice. We've got to change that, right? Part of this is like people need to know that that the mayor has integrity, that there's transparency. We're going to make decisions. Some of them people may not agree with, but we need to do it in a way that's transparent and people are clear on where we're going, right? So that is something I want to particularly focus on as the mayor of Sacramento from the outset, right? So we, again, rebuild confidence in city leadership. And then, of course, we need to have particular focus on, frankly, the top issues that people bring up, and that's homelessness and public safety. That's what I'm hearing from all parts of town, many communities, with rare exception, that's on top of people's minds. And so we need to have, particular focus on those issues. I'm going to have relentless focus on addressing those issues for the people of Sacramento. Once we can try to get those, start making progress on those issues, then we should. Then I think we can have some other conversations about other things as well. But people are frustrated because they see this lack of action, and it's we need to deliver results, and that's what I plan to do is deliver results with the people of Sacramento.
So, learning all this new information about you, do you feel safe in downtown? Why or why not? And what would you change?
I would have to say that, I personally feel okay downtown, but I understand why people don't feel safe, right? And it's not comfortable when you have someone who may clearly have a mental health issue, who may be, screaming and yelling at you when you're going downtown. Unfortunately, people have been assaulted. I got assaulted by an extremist. I didn't get assaulted by someone who's on other people on the street. But it's, those are problems. And certainly if I had to try to figure out how to walk around tents and encampments and so forth. And I can see how, that becomes a problem for people as well. Also, I've gone out and met many of the people who are unhoused on the streets, and we need to figure out how to help them as well, right? And help them get off the streets. So those are the things that we need to focus on, because too many people don't feel safe on the streets. By the way, it's not just that because people are there, that's a problem. So, for example, we've heard about businesses being burnt down. In fact, I went to a small business and it was, to go shopping, and it was, smell the smoke. And they apologized, but they said, well, there was a person who was camped under the eave of the building their business was in and lit a fire. And they had to go out and put it out. And that's why there was smoke everywhere. So, and we've had businesses actually burned down, right? That's a problem, right? And so we need to be sure we address that. We help people get off the streets. We don't need fires. We don't need to have blight, needles, trash on our streets. That discourages people from being able to go to our public spaces. It does make people feel unsafe.
Will be voting for the first time in Sacramento.
All right.
And I'm wondering what advice you have for myself or for other young voters where this is their first time voting.
All right. Well, first of all, please vote. So it's really important. Let me just make a comment about the voting. So first of all, of course, you want to make the best decision possible, and sometimes it can be hard because there's a lot of noise, right? You collect all the mailers, you get some positive ones, you get some things that imply certain things, right? You go look up websites and so forth. But in the end, you got to figure out who really seems. which candidate seems to really connect with you, right? And so it's great when you're able to do your research. But the other part I do want to also say is that, so sometimes you're like, well, you know what, I like all of them, or I don't like any of them, or right? That's possible. You could, but it's still important to vote. And let me just tell you why, as someone who actually has run campaigns, okay? And is that now as a person who's running for office, as a candidate, right? As someone who's been in elected office, I know that in campaigns, we don't know which way you voted in the past, but we do know whether you voted or not.
Mm.
That's all public record, right? So when people go knocking doors, they go knock on the doors of people who voted before, right? All right, you notice they don't go to every door; they kind of hop different ones, right? So we know who's voted and who hasn't voted. Okay, and what does that mean? Well, if you happen to live in a precinct in a neighborhood that doesn't vote very much, again, as an elected official, we serve everybody, but the but is that people do know which parts of town people vote in, and therefore those people will care what you do, and which parts of town people don't tend to vote as much in. And so that's why it's really important to vote. You know, even if your person doesn't win, you've sent a signal that you care about whoever wins, what they do. So don't forget that part of it, right? You certainly hope the person you like and you want wins, but even if they don't, you need to send a message to the person who is elected, who holds that office, is that when they go and they look and they go, oh, they're not probably going to look for your name in particular, but they're going to look at your neighborhood and go, people in that neighborhood vote. So I better listen to what they want to say, because the next election they'll vote again. And right. And so that's important. By the way, the other thing I should also just point out is that in addition to, of course, knowing whether you voted or not, we also know how often you voted. And so, people who vote more often get more information from the candidates, right? Candidates, we don't have infinite amount of money, so we tend to communicate more with people who've voted more often. They're, just a little secret for you to know. So that's why I said, be sure you keep voting each election, because if you keep voting each election, you're going to get more stuff about the candidates.
And so being a public health advocate, or someone who is concerned about the health of Sacramento, we see that the fentanyl overdoses have increased in Sacramento substantially, and pretty much around the country. But we do know that it's up 400% for young people here in Sacramento. So what kind of and I guess Adrian just woke up because he's starting to post stuff and what we already posted. But anyway, what kind of things are you looking to implement in response to the fentanyl overdoses here in Sacramento? And that, of course, that was a number from Sacramento County. I apologize, not the city. I have not looked up the specific city statistics, but I do know that it's an issue. So what are you looking to do? Because I was just reading not too long ago about Mayor Breed in San Francisco, and she's trying to implement, in order for certain folks to get the cash assistance, they would have to be screened for substances. And so I'm just wondering, do you have any type of proposals that you're interested in implementing regarding the fentanyl overdoses here in Sacramento?
Well, there are several things we should be looking at. In fact, when we look at homeless people are unhoused who die on the streets, a lot of them it's from fentanyl and drug overdoses, right? As well. And so some of the things we need to do, one is that we need to be sure that Narcan, which is a opioid reversal medication, is widely available, and we should be trying to get it out as much as possible, so that when people do have an overdose of fentanyl, hopefully we can save them before they die. Right. So we should be thinking about how to get Narcan out as much as possible, right, in the city. So it is carried by the various first responders, but frankly, out in the community as well. And so that's kind of like the safety net part, right? How do we do that? The other thing is that we need to, and this is where I have to work with the county, is how do we increase the availability of substance use treatment, right? And so how do we get people off opioids and then get them the treatment, right? Now, the other challenge with fentanyl is that now they're spiking fentanyl into all sorts of other things. So someone someone may not be necessarily thinking they're taking an opioid, and yet there's fentanyl in there, right? So we do need to be looking at what can we do to try to reduce the supply? Although, again, that's a nationwide problem as well. But ultimately, what's most important is that people need to know that if someone needs help, right, or they need to help somebody, that they can provide that help and they're not going to get in trouble, right? And so that's going to be really important. Otherwise, people do die when they can't get help. And that's why we need to get Narcan out available. We need to increase the amount of substance use. We also need to people shouldn't be, getting in trouble for basically rescuing somebody else as well. So those are some of the things we should be looking at. I'm not sure screening everyone in order for them to get public services is necessarily let's put it this way. It depends the purpose of the screening. If the purpose of screening is to deny them services, that may be counterproductive. What we should be doing, but if we're screening in order to get people assistance, so we can identify people who might, who need that help, then that can be helpful. So I think it's going to be important to think about, what approach we're taking when we do the screening, so that we can get people help. And because if you scare people from getting help, then things just get worse.
Yes, and just to clarify, I may have misspoken, but it was people found to be using illegal drugs would be required to enroll in treatment if they want to receive cash assistance from the city, which maxes out at just over $700. So cash assistance, they would have to voluntarily, because we know that treatment is you can opt in or opt out. So they would have to enroll in order to be eligible for city cash.
Okay.
So, and we have about 3 minutes left. Does anyone have a question that is just burning on the inside that they would love to ask Dr. Pan? You're leaning forward. Is that a yes?
It's not a serious question, but I'm also a former Aggie, and I just wanted to see if you were still involved in alumni events or anything in the community.
Oh, you being selfish. You
Okay.
trying to talk about your own self. Okay. All right, Dr. Pan.
So actually, I'm back on faculty at UC Davis. I'm teaching actually the health policy class in the spring semester.
Oh wow.
So I'm looking forward to being involved in more Aggie activities, and so it's great to have an Aggie alumna that's here.
Don't gas her. She's feeling real special today. Do you have a last question that you want to ask, Keela? Anybody?
That's fine.
I was gonna just say, was college always an option for you?
Dr. Pan, was college always an option for you?
So yes, I tell people I'm very fortunate in that I said my parents were immigrants, but they came for graduate degrees. So I came from essentially a professional family. So we're pretty solidly middle class. My father was an engineer. We're both engineers. My mother was initially an architect. And the expectation is that all the kids were going to college. So it wasn't even so much of an option. We were expected to do so. And both my parents had graduate degrees as well. So I did come from that kind of household. I know that for many other people, college is something that they may be the first in their family, that they look at the expense of college and they wonder how they're going to do this. And we need to provide people with more opportunities and options. And frankly, that's why I'm on the board for IYT. I mean, I was involved with the organization even before then when I was in the legislature. So I just recently came onto the board, but really need to be sure everyone has an opportunity to not only get an education, but also to have a great career and a great life. And that's what's going to make Sacramento great, when we can have that opportunity for all the people who live in Sacramento, especially our youth. And the other thing I just want to also say, and I appreciate being here on this podcast, is that too often policymakers look at youth as being a problem that need to be solved instead of an asset that can to build on. And my view is that the youth have so much to give to our city, to our state. You're a partner and an asset, and that we should be working with to be sure that we make the city successful and also to create better opportunities for our youth.
Well, we would like to take this opportunity to tell you thank you so much for your time and for joining us here on Black versus the Board of Education. Some people are scared to come see us, and I'm so glad that you're not, because they never know what's going to come out of our mouths. But giving the young people an opportunity to interface with folks who are running to represent them is a critical component of getting them used to actually talking and expressing themselves. So thank you so much for your time, and we hope that whether you win or lose, that you come back and see us again.
Oh, definitely.
The invitation is open.
All right. Fantastic.
Thank you so much. So next week, you guys, although Quinessa was giving some props to Dr. Pan, we actually have the president of Sac State joining us next week. Singers up for all the Stinger alumni in the building. We can't wait to have Dr. Luke Wood join us for our conversation next week. So y'all be ready, because hopefully he's going to come in and tell y'all what got me involved into educational advocacy, because I used his reports. So I'm looking forward to that. We will see all of you next week right here on YouTube and Facebook, or if you're listening on Spotify or Apple Podcasts, we will see you next week right here at 4:30 PST. We are Black versus the Board of Education. Go ahead, look towards the camera, give them a peace sign. We out of here. See you next week. Bye-bye.